Hey gang, it's Saturday and it's my second video in the journey to deal with chronic back pain, pain management docs, surgeons for Spinal Fusion, and working on the second opinion from a surgeon. But in the meantime, I saw the chronic pain or the pain management doc and told him that the pain had really increased over the last 2 or 3 months, and that I was seriously considering surgery. And he has never seemed to be a big fan of spinal fusion, and I don't know quite what to think of that, because he's a guy who sees it all, and so I'm sure he is seeing patients that have had spinal fusion, because one of the things that the surgeon will tell you is that they hope, quote unquote, that you'll be in less pain afterwards. No guarantees, but that you'll most likely still be under the care of a pain management doc to some degree. Happy day. So you go through this, probably one of the most serious surgeries, anybody could go through, and you don't have any real guarantee that you won't still be in the care of a pain management doc and still be on some type of med to get you through the day. So that's what makes the whole surgery itself just such a difficult decision, and why most people that have this spine issue, whether it be Sherman's disease or severe kyphosis, that is equaling the muscle pain that you have on a daily basis, research it for so long, because of all these factors that you're hit with: the seriousness of the surgery, the fact that you could still be in the care of a pain management doc and still be on a form of opioid. So you got all these things going through your head, and you're weighing all the pros and cons, and you're talking to people that say, I would never get spinal fusion done, and then you're those that say, well, you shouldn't be on even a mild form of an opioid for the rest of your life, and the story goes on. So anyway, I was telling him that it's just increased, so he upped my Butrans patch to 20 milligrams. So there is a 10, 15, and 20 of the patch. So I'm now on the 20. I started that yesterday, Friday, and honestly, not yet anyway, do I feel any real difference in the level of pain that I'm used to dealing with on a daily basis. Fingers crossed that maybe that changes, but that could tell me a lot over the next 2 or 3 days if I don't see an increase in the level of pain that I'm dealing with and being on a higher dosage of the medicine. The other thing is, I did work on an appointment for a second opinion, and I went ahead and reached out to the Mayo Clinic in Jacksonville, and thankfully I have really good insurance that will pay for something like this. But it looks like the way they work, you go and you visit for 2 or 3 days. It's not just making an appointment with a spine surgeon. They literally want to take you from A to Z, your entire medical history, what you've done to battle this already. They will take you through their own pain management track while you're there, and see if they'd be doing anything different than you're currently doing. Then they'll send you over to the spinal track and meet with, whether it be a neurosurgeon or somebody that specializes in spinal deformities. So it's kind of cool. So they literally have housing there on campus. So as they figure out where they want to put you, they start making appointments for you either the same day or the following day with the folks in the specialty that you need to be seeing. So I guess there's a reason that Mayo Clinic is known as one of the best hospitals in the world, really. And we're fortunate here in Florida to have a branch of that in Jacksonville. So I'll be doing that in March, and I'm quite interested to see what both the pain management side of the Mayo Clinic thinks, and as well as what the folks that specialize in neurosurgery and spinal deformities think. I'll have two opinions to compare and see where we go from there. Again, I want to thank everybody that has helped me on social media and communicated to me about their journey. This is my little piece of trying to give back to folks that are in the same position I am and making these huge decisions and dealing with chronic pain on a daily basis. Have a great weekend.